The Affordable Care Act by Group 5, Larry Bird, Makita Bird, Haneen Khalil, Maya Simmons, and Matthew Solomon. Who was newly covered by the Affordable Care Act and how was this achieved? By Makita Bird. Individuals who were covered by the Affordable Care Act were individuals who were initially denied health care due to pre-existing conditions, as well as those without employee-sponsored coverage, those who simply could not afford health care costs, middle-class and lower-income families, as well as young adults. 17.7 million people were newly insured by the Affordable Care Act by October 2013. This was primarily done through exchanges and Medicaid. Like previously mentioned, a large majority of those newly insured, around 2.3 million, were young adults. This was achieved because young adults were able to stay on their parents' health insurance until the age of 26. This took effect in 2010.
At its core, the Affordable Care Act was developed to do two main things. First, to increase the number of individuals in the United States who had health insurance, either sponsored by their employer or sponsored on their own. The other idea, of course, was to make actual health insurance more affordable for all classes of people, regardless of their socioeconomic status, their race, their religion, or, in some cases, sexuality and, and pre-existing conditions. A major aspect of this was the expansion of Medicaid. Medicaid is the nationally funded insurance program specifically designed for low-income individuals. The idea behind this was that some low-income individuals and low socioeconomic status individuals could not afford health insurance either through their employer or on their own. The idea was to lower the level of the poverty line so that more individuals would qualify for this type of insurance. The expanded categories of individuals who would become eligible for Medicaid would include children and pregnant women who were already eligible for Medicaid, disabled adults and low-income families who had some levels of Medicaid, and childless adults who at the moment had no access to Medicaid. In exchange, they would lower the poverty level to 138%, which would allow all of these people to qualify if they were in the lowest level of socioeconomic status. The idea was really popular, but unfortunately in 2012, the Supreme Court ruled that the federal government did not have the right to enact the expansion on behalf of the states. So, this meant that it was up to the states to decide whether or not they wanted to expand what Medicaid was offered. Currently, in 2017, 31 states have expanded their Medicaid program. Now, unfortunately, that means that there are still states outstanding where Medicaid does not cover individuals. But in those states that it was expanded, not only did the number of people who were covered by Medicaid increase, but studies have actually shown that people who were already eligible for Medicaid were encouraged by the Affordable Care Act to go out and sign up for it on their own. Overall, this increased the number of Medicaid users, increasing the number of individuals who are covered in healthcare. Now, of course, the other side of the Affordable Care Act was how can we make healthcare more affordable, not only for those at the lowest level of economic status, but overall across the country. The idea was that if we open the borders of where health insurance covered, this means that let's say if you live in the state of Florida, like I do, I could then look at insurance companies that were based all across the United States, from California to New York, anywhere in between. The idea was that if we put all of the insurers in this one overall market, that the basic principles of economics would mean that they would have to lower their prices, meaning that certain health insurers, usually the smaller ones who already have lower insurance premiums, would be able to kind of move to the top as the cheapest option. Of course, several other things were included in this idea. Again, pre-existing conditions would be automatically covered by all insurance companies, and that was enforced in the very law itself. The other idea was that health insurance needed to cover more services, that it could not just cover doctor's visits, prescription drugs, it needed to cover all types of medical services. And lastly, it was determined that all employers had to provide health insurance for full-time employees. Now again, there's a little bit of a loophole in there. Full-time employees. Vastly, we've seen in low-income places and low-income neighborhoods that a lot of these individuals are actually working multiple part-time jobs. Their jobs are considered seasonal. Some jobs are even considered hourly, and therefore some employers have been able to get out of providing medical insurance. Again, the system wasn't perfect, but the idea was to expand the number of people who had access to health insurance while also forcing competition to lower insurance premiums. 9 years later, after the Affordable Care Act, we have some research to see if that was successful or not. And in truth, there are some pros to it and there are some cons. Overall, we have to say that insurance premiums under the Affordable Care Act have gone up, and they've gone up significantly. This is across the board. However, there is some ways to see that this could be a pro. First of all, some studies have shown that the rate of increase, the rate of insurance premium increase, has actually slowed down since the Affordable Care Act. So in 2010, between 2010 and 2011, where we saw a 20% increase in insurance premiums versus in 2012 to 2013, we only saw a 13% increase. And this number has dwindled as time has gone on. The other big thing is that these insurance programs are having much higher rate of coverage. That means that individuals are being covered for far more health-related problems than they were in the past. Now, that's a pro and a con as well, because we have some individuals who are at higher risk for medical care, whether they be the elderly, children, or of course individuals with certain chronic health conditions who we know are going to need more health insurance over time than your average healthy adult. And of course, the big thing, and one of the most important things to think about, is that thanks to the Affordable Care Act, more Americans have health insurance than ever before. This means that as a population, we have in place a real preventative healthcare system. Now, of course, there are cons. Obviously, insurance premiums have gone up, and they have gone up for all individuals. In addition, deductibles have risen, which means that people are paying more money out of pocket to pay for these healthcare costs. Another big issue, and an issue that is going to continuously grow simply because there is really no regulation there, is prescription drug costs. We've seen in the past 3-4 years hundreds and hundreds of cases of prescription drug companies being able to raise the cost of their absolutely essential drugs that they're producing. The most famous case is with the rise in EpiPen costs. Of course, EpiPens are considered a medical necessity for individuals with severe allergies. However, because it is a private company, they are allowed to affect their prices on their own. And of course, the biggest con is that at its core, the Affordable Care Act was to make health insurance more affordable. And frankly, at the moment, the middle class is taking on a great deal of the financial burden. Simply because, while yes, competition has increased, most people are still going to local insurance companies, and local insurance companies are currently being purchased by the bigger insurance companies. Therefore, the deductibles and the insurance premiums have really not been affected as greatly as we thought they would. Does that mean the Affordable Care Act was a failure when it comes to insurance premiums? The answer is the research is still unsure. Because we have seen some positives, by slowing the rate of increase, eventually we will reach a plateau where hopefully insurance premiums should not rise anymore because they should balance out with the cost of healthcare. However, in the interim, most Americans who supported the Affordable Care Act are now being faced with a very real possibility that their premiums are going up because they are covering higher risk individuals. Again, this doesn't mean that the Affordable Care Act was a failure or a success. It's just the simple fact that because of the expansion of Medicaid not being as successful as they thought it would be, and because of this competition model failing to produce the results, now in 2017, we are still looking at higher insurance premiums and a great deal of low-income families who are still not covered under the Affordable Care Act.
This is Haneen Khalil. I will be discussing the following two topics. What are exchanges and how are different states approaching them? And what are some of the key implementation challenges facing state and national policy makers? What are exchanges and how are different states approaching them? The first thing that I would like to clarify is that exchanges is also health insurance marketplace. Few states are state operated, state federal operated, and majority of the states are defaulting to federal exchanges, as you can see in the picture on the right. Maryland is an example of a state operated exchange. The Patient Protection and Affordable Care Act was specifically designed so that in every state of the United States, people are able to purchase some sort of health insurance that they can use to help in their healthcare and special needs. The reason why some states wanted state operated was because they wanted some control and providing their own outreach program to provide assistance for first-time buyers. The way that some states are approaching this is by disagreeing so that they can cause enough damage to renegotiate the term of the exchanges with the states. What are exchanges and how are different states approaching them? The first thing that I would like to clarify is that exchanges is also health insurance marketplace. Few states are state operated, state federal operated, and majority of the states are defaulting to federal exchanges, as you can see in the picture on the right. What are some of the key implementation challenges facing state and national policy makers? The first key point is that state policymakers understand what's good for its people, as many issues go directly to the senators of the states. Second key point is that national policymakers have more resources and are more obligated toward the health of the nation as a whole. Third key point is that states in favor of the Affordable Care Act believe that this is the right way to provide all of its people health care coverage. Fourth key point is that keeping people healthy are the main points for both, but the challenge is knowing what is right for its people. Fifth key point would be developing system that can benefit patients in a more pain-free and efficient way. The final key point would be developing an enhanced healthcare policy that can be affordable. Does it help if states and national policy makers cannot agree on anything that's good for the health of its people. What are some of the key implementation challenges facing state and
When the Affordable Care Act was first introduced and debated, some opponents of the law argued that it was not needed because uninsured people already had adequate access to care. Since its passage, others have argued that the insurance coverage provided to people under the ACA provides insufficient protection against high costs or offers such limited networks that the newly insured cannot find care. These both prove to be false because access to care has expanded and costs lowered. Gaining insurance coverage through the expansions decreased the probability of not receiving medical care by 20 and 25%. Gaining insurance coverage also increased the probability of having a usual place of care between 47 and 86%. These findings suggest that not only has the ACA decreased the number of uninsured Americans, but has substantially improved access to care for those who gained coverage. Many younger people went uninsured due to the cost before the ACA, but due to the ACA marketplace coverage expansions, more insurance providers are mandated to provide a wider variety of healthcare services to patients. Political debaters argue that the positive of the ACA is that many more people get access. The negative is that it costs people and the government money. Spending on healthcare from emergency room visitations, prevention, and procedures will increase, reducing the amount of money the government saved on healthcare before the ACA. But isn't it worth it if more people have access to health coverage? When the Affordable Care Due to the expansion of healthcare and healthcare services made newly available to the vast amount of uninsured Americans through the ACA, political debates assumed the quality of this care would not be as up to par as before. A second assumption was that medical workers would have limited time to treat and see patients due to the higher influx of patients after the ACA, in an effort to cut costs and spend less money. Politicians argued that while the ACA makes healthcare more accessible and even cheaper for buyers, this will likely come at the expense of healthcare quality. Improved quality will either result in increased costs or reduced access. Because healthcare access is now given to those with pre-existing conditions, their quality of life is likely to improve due to their regular physician visits. The Affordable Care Act improves access to preventative services in Medicare and Medicaid. It eliminates cost sharing for certain Medicare covered preventative services, waives the Medicare deductible for colorectal cancer screenings, and provides coverage for personalized prevention plan services, to name a few. In Medicaid, the ACA provides states that offer coverage for recommended preventative services with no cost sharing. Due to the
Hello, this is Larry Bird with Group 5. I will be presenting Is the Affordable Care Act a good or bad law? How the Affordable Care Act is a good law for healthcare. Its aim is simple: to extend health insurance coverage to some of the estimated 15% of the U.S. population who lack it. Those people receive no coverage from their employers and are not covered by the U.S. Program for the Poor and Elderly. To achieve this, The law requires all Americans to have health insurance but offers subsidies to make coverage more affordable and aims to reduce the cost of insurance by bringing younger, healthier people into the medical coverage system. It also requires businesses with more than 50 full-time employees to offer health insurance. The law creates state-run marketplaces with websites and shopping sites where individuals can compare prices as they shop for coverage. Some states have not chosen to participate in the ACA, and their residents can shop on a marketplace run by the federal government. In addition, the law bans insurance companies from denying health coverage to people with pre-existing health conditions, allows young people to remain on their parents' plans until age 26, and expands eligibility for the government-run Medicaid health program for the poor. The law aims eventually to slow the growth of U.S. healthcare spending, which is the highest in the world. How the Affordable Care Act is a bad law for healthcare. The Supreme Court's 2012 rule found the ACA constitutional, but also struck down a provision saying states had to change how they administered the government health program, Medicaid. Under ACA, states were supposed to expand the number of people who qualified for Medicaid, which had been reserved for the poor, and in turn, the federal government would provide the states more funding. The court said states could choose not to participate in Medicaid expansion. As a result, poor and working class families who didn't qualify for Medicaid found themselves having to pay for private insurance. Insurance companies started backing out of participating in ACA because fewer Americans than anticipated are signing up. That in turn raises insurance costs for everyone, which then further drives down participation. For some middle-income Americans, the subsidies available for buying ACA policies are not generous enough, and the fines for not having coverage are too small to encourage them to enroll in plans. Premiums are to be raised by an average of 25% in 2017. This increase was predicted at the start of the law, and government subsidies to help pay for insurance will also increase. But those who should be covered by the Medicaid expansion aren't eligible for those subsidies. Conclusion: the Affordable Care Act is a very complex law that has advantages and disadvantages in the healthcare system. While the law becomes more of a debate, the goal is clear. The ACA aims to make healthcare more available and more affordable for all Americans. It's estimated that 22 million Americans will lose medical insurance if the Affordable Care Act is repealed. Provisions of the law make care accessible to those who had previously been shut out, and the uninsured rate has dropped by 5% since the beginning of the Affordable Care Act.